by Mike Strauss. Mike completed his undergraduate degree here at Michigan State University, and he is currently working as a physician assistant with sports medicine in the Department of Orthopedics, and he also oversees MSU's field hockey team. So I would just like to thank him and join me in thanking him for graciously supporting all of our lecture series throughout the years. So tonight, we are very excited to have Dr. Dan Gould, who I personally know, who is a wonderful man. And Dan is currently the Gould Professorship of Youth Sport and Student Athlete Well-Being. He's also the director of the Institute for the Study of Youth Sports at Michigan State University. His current research focuses on how coaches teach life skills to youth athletes, the psychology of coaching, and sport captaincy experience. Dan has dedicated much of his career to applied sports psychology and efforts as a mental skills training consultant, coaching educator, and author. He's consulted extensively with athletes of all ages, from youth sport all the way up to United States ski team, USA wrestling, USA figure skating, professional auto race car drivers, as well as numerous other Olympic athletes. He's given hundreds of coaching education presentations and developed numerous coaching and coaching education programs aimed at coaching ranging from youth to Olympic levels. He's also served on several United States Olympic committees. He was 10 years, as well as the co-chair for the Sports Science and Technology Committee for the USOC. He's currently a member of the USTA Sports Science and Coaching Committee. And for all of you who have gone through a kinesiology or psychology program, he is the co-author of the Foundations of Sport and Exercise Psychology, a book that is widely used around the world. So today we are very honored to have Dr. Dan Gould speak today on psychology of the injured athlete.
Can you hear the back okay? Not too much vibration or anything? Okay, good. It's wonderful to be here. I am a little nervous, actually, and typically I don't get too nervous. But it was funny, like, we had a conference a couple weeks ago in Japan, and, I wasn't too nervous there, but I get to fly home and they'll never see me again. And if I kind of mess up here, I'm afraid of Tracy, and Shelby I'll let down, and Chris, so I got to be careful how I do that. But it's fun to be here. It was a little hard to judge the level, so I'm going to try to do an overview of what we know about the psychology of injury. It's really, I'm really blessed because about 25 years ago when we were doing our book, we decided to put a psychology of injury chapter in, and frankly, there weren't that many articles. And now it's unbelievable the number of articles, like just prepping for this. I found a couple randomized clinical trials looking at using imagery for following up on surgical techniques, and so there's a lot going on, so I'm excited to tell you about that tonight. So my role tonight, number one, is to describe the role of psychological factors in injury and injury rehab, and then understand the practical skills that you might be able to use in the rehab process. And I told Tracy when I got ready for this, unfortunately, as I've aged, I get hurt all the time. And I'm always down in their offices asking for advice. And I don't get hurt. I used to get hurt as an athlete. Like I was a college wrestler, all athletes, you get hurt. Now I get hurt typing. I sit the wrong way at my computer, and all week long I had a pulled neck muscle. I don't know where they come from. So it's amazing. And I've actually had some knee issues, so I've gone to physical therapy. And it's been a really good experience for me because I've got to be a patient. But I also got to watch some of our interns work with a physical therapist or certified athletic trainers, and kind of got ideas how we can better use techniques, and also try to be a little more realistic. Because, you got a whole bunch of clients coming in, you don't have much time. The research articles make it sound like you have 20 minutes to do an intervention, and it's sort of like I got to have something quick that I can use and help them as we go on. Okay. Tracy talked a little bit about my background, and she's already mentioned the research stuff and the teaching. One thing I've been really lucky to learn a lot lot from is now the U.S. Olympic Committee, or now it's called U.S. Olympic and Paralympic Committee, that's a recent change. But I was on their Sports Medicine and Science Committee a number of years. And I was really able to learn from the people in those committees, many of them physicians, orthopedic surgeons, physical therapists, and now on the USTA Sports Science Committee. So sitting in these meetings, we have to come up with policy in tennis, for example, anything from heat and humidity, how much juniors should compete. And there's some just real practical realities, like in tennis, how much should they be playing in Texas in the summer when it's really hot out? And we don't even know the average match of a junior match, the average length of a junior match. We don't know, for example, how many forehands the junior hits, and yet you're trying to come up with guidelines. So I think there's a lot for us to learn here. And Tracy mentioned I've consulted with a lot of different groups, wrestling, figure skating, and tennis. And then I do a lot with coaching education, particularly a lot with the National Wrestling Coaches Association. We've done a leadership training for a lot of the college coaches. Actually, I'm pretty proud of that. I've probably been involved in the training now about 60% of all the college coaches in the U.S. It's actually about leadership and about how to work with your trainer, not sort of wrestling technique, more using sports science, those type of things. And we worked a lot with the Michigan High School Athletic Association. So I got interested in the psychology of injury, and in full disclosure, I know they do that a lot in medicine. I'm not an expert in the psych of injury. I've done some studies. I got interested in it when I worked with the U.S. ski team, and everybody kept getting hurt, and I didn't know what to tell them on the psychological side. So we ended up doing some qualitative studies on athletes who had season-ending ski injuries. And we interviewed them and found out what it was like and what the experience was like for them as they worked through it. And we learned quite a bit. And I was really interested in how can we help that athlete. And surprised a little, that one study, and the other literature supports this out, a lot of the injury, while the physical stuff obviously is critical, a lot of the stress comes from all the mental, being away from your teammates, wondering if you'll be back to the same level before you got hurt. And then, as I said before, being on the committees and my own history of being injured, especially as I've aged, which sounds funny, but you get old. I used to have to tape up to wrestle or play football. Now I have to tape up to watch from Iron Circle to Erickson. And then I come back injured. And then go see all my friends down the hall in the Tracy and Chris's office. Okay. I'm going to put you to work a little tonight. So I kind of wanted to know, because I'm willing to change my talk midstream to meet your needs. What do you want to know tonight? What were you hoping to get out of this? So I'm going to have everybody maybe just share with a neighbor, take 1 minute. You thought that pizza was free. You got to work for it now. You got 1 minute to think about what you'd like to get out of tonight's session. Test 1, 2, 3. I don't mind yelling. Okay. It's a large room, I know, so if we have a few people who can, it's driving me crazy, but who can give me some examples? Bruce down here told me that he's interested in many of the, he's a physical therapist in private practice, I think. Okay, who used to be private practice, and he's working for somebody now. But he said not only does he work with athletes, but he worked with like middle-aged athletes, more recreational, and sort of the mindset, it's different. They're not driven. And I've talked to physical therapists. We work with college athletes who are pretty motivated. You work with a roofer that gets hurt, he may not want to go back to work. And he may, so you're trying to get the rehab and other kind of things. So, kind of getting to know the individual. So I thought that was a good example. Who else has some things you want to know? Yes, ma'am.
What strategy to take back to get my coaches to buy in?
Okay, really good one. What can you do to get coaches to buy in? Okay. Try to remember some of these and come back to it. Any others? Yes, ma'am.
How do you get an athlete that's no longer motivated to get better? How do you get them remotivated in rehab process?
Okay. Yeah, sometimes we make, even I just made that assumption just because they're athletes, they're really motivated. Sometimes they may not be as motivated for a variety of reasons. One, they just may be so dejected about the whole thing. Or two, they weren't quite happy with playing time and a bunch of other things and just mad at the world. So how do we help them through the process? Okay? Any others? Yes, ma'am.
How to recognize a little bit earlier when you might encounter an obstacle to some of the rehabilitation.
Okay, yeah. When do you run into obstacles with rehab in the rehabilitation process? I'm not sure if I can catch all of these, but hopefully in the question and answers. Don't let me off the hook on the coaches one, because that's a tough one. Having worked with a number of athletic trainers over the years, it's really hard because legally you're often held responsible. And you might be 28 and the head coach is 48 and pretty driven. Excuse me, sir, but you can't do that. Type of thing. And the rules have sort of changed quite a bit. So so I don't forget, we run into the same thing in psychology when we work with coaches on confidentiality. And one of the most important things to do is to sit down with the coach at the front end before you're in the stressful situation and talk about roles. Here's what MSU Athletics and Sally and Jim and everybody else, my role is supposed to be. I know your role. How should we handle it if I know you're human? And again, I see it from afar, so some of these are stereotypes. But Coach Izzo is pretty driven. I was good going, I'd hate to have to tell him Jeremy's out for the rest of the year or whatever. I'd be like, I don't know if I want to go into the office and tell him that. Now, I don't know Coach Izzo, but I'm just saying because he's so intense and he wants to win so bad. And he likes the kid. That's a real awkward one. So I think in the off season when everybody's more relaxed, maybe bring up those scenarios. If there's a scenario like that, how should I approach you? If you're really mad and the team's been playing bad, when should I, what if? It's ironic, we do that with Olympic athletes before they go to the Olympics. We do about 2 months before, what if this happens, what could you do? What if this happens? So I think as an athletic trainer, you're performing on Saturday or Thursday night or whatever the game is, and kind of making sure your coach and you know the rules. And even if that meeting doesn't go well, then you kind of say, okay, we're going to have troubles with this. And if you have peer supervision or a supervisor, you might chat with that individual about how do I negotiate this. And maybe they need to intervene. Because, like today, and again, I know enough to be dangerous, but just, I was watching the newscast the other night, and okay, did he have a concussion from a hard hit? Did Coach D decide? Did somebody else decide? Then all of a sudden it's in the media. So we're under a lot of scrutiny today. So I think the more you can kind of rehearse and do what if, and especially if you're younger, and to make sure that coach really understands that situation. So I hope that helps a little, I don't know. Okay, let's kind of continue on. I'll skip a few things tonight because I want to make sure we get to some of the issues you brought up as we go through. I don't need to tell you this. The good news for your profession, a lot of people get hurt in sport. That's not good news. It's kind of a weird. We used to do a big program at the Junior National Wrestling Tournaments many years ago. It's the largest wrestling tournament in the world at the time, 20 mats. And we used to do coach training on athletic medicine. And the first round of the tournament, you'd see every injury. And ooh, we got a dislocation. So it was actually, in a sick way, like a training ground to learn about it, because you could run around from mat to mat. But then the other side of it, some poor kids hurt. But we get a lot of injuries. This was a Swedish study I looked up today with pretty high-level soccer. Sweden, 75% of the elite soccer players will sustain a major injury during the year. 56% of athletes. I read a number of studies looking today, don't return to pre-injury form after shoulder stabilization surgery. The ACL numbers were all over the place. The number of people who don't return to where they want to be, from 30% to 40%, I saw quite a bit. And obviously, even though I'm into the sports psych stuff, a lot of this is physical. The surgery might not go well, there's ligament issues or whatever, all the stuff you guys are a lot smarter than I am at. So, we're not saying that's not the case, but sometimes our psychological issues in the way, and can we do something about it? So tonight I was going to talk about 3 sets of factors, and if you review the psychology of injury research, which has really grown now, so it's a pretty good evidence base. The first one is how psychological factors are involved in the onset of injuries. Second, what are the psychological reactions to being injured? And third, what role can psychological factors play in rehab? So, first, sometimes I'll go to our meetings and you'll hear a psych person or a sports psych person. They're all into everything psychological. People get hurt because of physical things. Big people hit little people. Your knee's in the wrong place at the wrong time. Equipment malfunctions. All right, so I don't want to make it sound like psychological factors are the predominant. It's not. Physical stuff is the predominant cause of injury or muscle imbalances. However, we're finding psychological factors can also contribute. All right, they don't cause it, but they can contribute. And again, in high-level sport, one key athlete goes down a season that wouldn't need to if you could control the psychological factor better is probably worth it. How injuries happen, obviously the physical factors I've already mentioned that you know much better than me. Muscle imbalances, collisions, overtraining, fatigue. One you see probably the biggest single variable in the psych literature coming up with injury is stress. Stress links to a whole bunch of stuff, like it links to medicine. A history of stressors and coping influences the onset of injury as does the athlete's psychological skills. I'll talk about some studies in a minute where they've had athletes doing stress management training, a lot of times to help them with performance, imagery, and they've tracked injury across the season, and the groups that were doing the mental skills training and better controlling their stress report fewer injuries at the end of the season. That's been demonstrated a few times. Obviously, social factors come in. If the guys or gals are afraid to tell the coach they're hurt, so then they get overuse injuries, those type of things. People have looked at personality. It plays a role, but usually not a huge role. Again, stress levels seem to be the highest thing that we're concerned about. Both life stress, heaven forbid, but Cassius Winston, I don't know him, but his brother, the awful situation with his brother, that is life stress. All right, so if I don't know these people, so I'm just using it because it's a local example, but if I'm working with basketball, my radar's up for the next few weeks because of the stress he's had about, hey, we want to make sure we're giving him plenty of recovery. We don't want to, this wouldn't be a week we want to push him too much. Other kind of things, because that stress puts him at a greater risk. And just hearing some of the news reports, it wouldn't, in a situation like that's so hard with death, and in young people with suicide, some of his teammates were talking about it was upsetting to everybody, not just the one person involved. A number of years ago, we had an issue with a softball coach dying here. It's very upsetting for the athletes, and those things we need to consider. This is a pretty famous model of how Anderson and Williams, how stress leads to injury. So we have potentially stressful situation here. Could be on the field stuff, could be off the field stuff, could be exams coming up. I'm not sure if I'm going to be eligible, grade-wise. It could be my girlfriend dumped me, my boyfriend dumped me, whatever it might be. And on the other hand, we have our injuries here. Not everybody reacts the same way to potentially stressful situation, so that's where some personality factors do come into play. That leads to certain stress responses like increased state anxiety. State anxiety is like a right now feeling of apprehension or tension. So, you're probably pretty laid back. If I called you up in front to dance on the table, your state anxiety would go up. Okay? And that leads to attention changes, muscle tension, which increases the risk of injury. And then they talk about personality factors, history of stressors, coping resources, all sort of affect this. There's some really interesting resilience research happening now, and it's a real tricky one for the coaches in the room, because we know more successful athletes have better experience dealing with stressors and coping as they've gone through. So they've had to face challenges. So a thing for a coach that's tricky, sometimes I've got to put my athletes in situations that are stressful to have them adapt and move forward. And yet we're in a culture now where we're trying to protect everybody so much, and for a good reason. So it's real sort of a tricky one, but if you have experience dealing with stressors, you end up being better able to cope with it, and you become more resilient. And the mental toughness literature shows that as well. I've become very interested in that. Like, if you look at SEAL training or Army Ranger training, how do you push people without breaking them? I also find it's really scary doing a lot of coach education work. If your coach is really emotionally intelligent, I think they can do a lot of this stress inoculation training. Because a lot of it's about reading the team and then pulling off. If a coach isn't emotionally intelligent, you're going to have a lot of burnout, overtraining injuries, overuse injuries, because a lot of it's reading the situation. This is an older study, one of the first ones that came out, but we think stress is the factor most related to injuries, but Smith and their colleagues in a high school study many years ago found that life stress didn't relate to it. So all the literature pointed that it did, they didn't find it. But then what they found is it was only related in the athletes, if you look here, who had low coping skills and low social support. So stress affected the athletes on the team differently. So if you had low coping skills, you weren't very well prepared to deal with stress, and you didn't have support, you were more likely to get injured. And individuals who are low self-esteem are more pessimistic, low in hardiness. Trait anxiety is sort of like your personality. You get, a high trait anxious person in new situations gets more nervous. A low trait anxious person views the situation as not as scary. You don't want high trait anxious people on the bomb squad. You want more of the low-key one, okay? And all those sort of tie into this in some ways. So this is a complex relationship, and then you get into fear of re-injury. One of the things when I did the work with the ski team that I think was really hard, and I should have mentioned this at the front end, I got interested in this because the athletes all told me, again, you're trying to be the best in the world, that getting an ACL was an occupational hazard. And if you stayed on the ski team more than 3 years, the probability was 90 or 100% you'd get it. And there was a book out I read just on the edge of crazy about downhill skiers, and that's how you win. You're on the edge of crazy. The crazy ones get hurt really quick. But even the best ones are on that edge, trying to do things no one ever did before. And just because of what they're trying to do, they all almost ended up with some sort of ACL. And I remember they said it's an occupational hazard. So then how do you cope with it? And sort of how do you go forward with it? And just one thing that we found really was effective. I work with freestyle skiing quite a bit. That's like moguls and the aerials. And the men and women trained together with one coach at the time. And one of the things we found is like we would have a buddy, a partner buddy, as a support. So one athlete, Donna, blew her knee out a year and a half ago. And another athlete just got their surgery and they're on their rehab schedule. We'd pair them up. But what we found was really the way to do it was across gender. So the female would then mentor the male. Because if two males are doing it, or two females, you're trying to take her spot on the team. You know, so we found it was a really good way because they trained together across gender. And I remember one athlete said, like the mentoring things that I would never think of, or I don't think the docs would think of. You know, I remember she told the person she was mentoring, you're going to find out that your knee's never going to feel like it did before. And you got to learn how to ski and be okay with it, not feeling like it did before you got hurt. You know, and those type of things. And that was and obviously you just don't pick any Yahoo to be a mentor. You pick the skier who had a good head on her shoulders or his shoulders. You know, not all of them would you want mentoring. But the ones that did, and the other, sometimes we do support groups, and that's the value of it going forward, because they've been there. And as I said, a lot of the research now shows teaching stress management skills is really important. I'll come back to this, because some people are doing it here as a preventative, but now some people are doing it before people go into surgery. And I just read a study today, Broadbent and her colleagues out of New Zealand, and they were looking at how well the lacerations healed. And they had like a relaxation imagery group along with, post-surgery normal. And the relaxation imagery group, they actually got some gains in the actual healing process there. And there was some others with ACL and some other type of things. So I think it's something that you really want to think about as a trainer. And the one thing that I think with everybody having phones now, you need to be grasping that technology, and you can do sort of individualized, customized things, like make an imagery script for your athlete, and then they can be playing that. So it takes time for you to sit with him or her to make the script. But once it's made, you can just give it to them. Or you can have it on your website if you're in private practice, and you make a generic one, which is not as good as customized. But in the real world, a generic's better than nothing. And your patients could download it and use it. If they're like most, 50% won't because they're not good at following directions. And 50% will, and you'll take the 50%. It's interesting to me how stress affects injuries. Let's take the attentional disruption. We know stress causes attentional changes. Think of the times in your life when you're really stressed. You can't sleep because you got uncontrollable thoughts. Or you're in a class and you can't concentrate. Heaven forbid, but you have a sick relative at home. And it's like, I can't think in class as well as I normally do. And we also know it actually changes it's an oversimplification, our attentional field. And I always use this example of attention disruption. I've got a football quarterback here, or his helmet anyways, and I've got an optimal attentional field. So if I'm the quarterback, I'm working, I'm looking here, and I'm here, and I see my primary receiver, I see the checked off, etc. Now, if I'm all over the place, coaches, they'll drive it, like a space cadet, it's way too wide, I'm probably not playing. But if I get really stressed, what we know stress does, it causes that attentional field to suck in, lack of a better word, and you scan less. So that's why in the game, you'll see the quarterback throw an interception, and how did they not, the guy next to me is always swearing, and when I watch the games, and you go, how does he not see him? Well, there's a 345, 400-pound guy chasing him with one eye and coming out of the helmet. He's going to kill him. He's running for his life. And so these things are important. And, and that's a football example, but, a gymnast gets a little attentional disruption, and she's on the beam, that type of thing. So that's one explanation. The other is increased muscle tension and coordination. We also, when you're stressed, hey, I could use a massage or whatever because of it. And again, if you think of a balance beam, and the fine lines they're working and a little increased muscle tension, we see it in basketball like in a free throw shot when they go forward. So that's why the stress, and what's interesting about this, selling it to the coach, there's a lot of good evidence that you'd want to sell mental skills, stress management, and imagery and things like that for performance enhancement. So if you sell it for performance enhancement, it may help our players play better. For the ones who get injury, now you can kind of rotate that through to the injury kind of scenario. Other explanations, I just won't go through these too much, but the 100% attitude, which is, again, I work a lot with coaches. We love players who give us 100%. And we all know that and those players are the hardest when they get hurt. Because they take rehab when you say don't do more than 50%. Their natural inclination is let's go 70. And they kind of hurry through it. Like failure to distinguish between normal discomfort and pain. Actually, I think if some of the students are interested in a research topic, I don't think we know much about that. But what's the difference? I was talking to Al Smith, our department head today, who was a college runner and runs now, about how do you sort of distinguish when it's I just need to suck it up and not be a baby. And I sucked it up and I wasn't a baby, now I'm out a week because of an injury. And how do we help athletes kind of determine? I was telling Al this morning, as one of our projects, we ran a mentoring program for U.S. tennis, where a former champion would mentor an up-and-coming player. And Chris Everett, the great champion, was one of the mentors. And we were asking the kind of things she told her mentee. And she said, well, one of the things that I told her, I had a really great career. I was seldom injured. And one of the reasons is as soon as I felt like something was wrong, I would stop. And it wasn't like she wasn't highly motivated, but she had this, so she talked to the player about that. So I think those kind of things are interesting. Obviously, sometimes we run into a coach, you're worthless, I don't want to see you. Hopefully we made gains there. 25 years ago, coaches would put players I don't want to see you. It's tricky because on one hand, motivation is so important in high-level sport. Winners never quit, all the kind of normative things we want. I think we need to get our coaches to kind of they shouldn't stop doing that, but they kind of need a corollary to it. Winners never quit, but they're also smart. It's like the old bold test pilots. Usually not many old bold ones. It's sort of the smart ones that survive. So I think getting our coaches to kind of, we do the macho stuff when we need to, but it's also a caveat, hey, but we need to be smart out there. There's also, I won't spend much time on this because I'm not an expert, there's better people in the room. But we know stress relates to catecholamines, other physiological mechanisms. There's some really interesting stuff starting to come about how that affects growth hormones and tissue growth when you're recovering from surgery or other kind of injuries. And I think that's a really interesting area for people in psychophys, or if you want to go down that road. One we forget about, stress causes sleep disturbance. A number of years ago when I was teaching one of my undergrad classes in the morning, I was frustrated because people weren't reading the book or coming on time. So I surveyed the class, and on average they were getting about 4.5 hours of sleep. And there's part of me going like, okay, my class is a high performance setting. We're flunking. And so why are you a zombie when you come in the morning? Because you didn't get enough sleep. So the whole thing there, I think us talking a lot more about sleep and how that, and you hear stuff, Tom Brady, I think Kirk Cousins does some of that. They've taken some really scientific kind of things and about how they sleep and during the season to kind of prepare their bodies for the long haul. Okay, what are the implications? Monitor your athletes' levels of stress on and off the field, and teach stress management skills, not only to help them perform more effectively, but when they're injured, unfortunately. And the first page of the handout I gave you, now this is not something validated, but I was trying to think of something that would be practical. I think this is what I wanted on this. But actually, I'll come back to this. I can see where I put this. Sorry. There's a stress recovery questionnaire. Maybe I forgot to put it in, but the stress recovery questionnaire has been used a lot. If you're in a sport like track and field, where you're trying to periodize and do other things, there's a whole book, Human Kinetics puts it out, where you can sort of monitor the athletes do this questionnaire, and it deals with like physical load, but it also deals with like social stress, psychological stress. That's probably not going to work for most of us. So I think just checking in with your athletes on a 10-point scale. Sally, how are you doing today? Okay, how's it going? On 1 to 10 scale, with 10 being totally stressed out, 1 being laid back, where are we? And start to ask them, so you're kind of monitoring where they can go, so you can kind of react to that. Okay, I'm going to jump into the reactions to injuries now. Do we have any questions on anything I've done so far? Any questions or concerns? Okay, let's talk about reactions to exercise and athletic injuries. A lot of times we'll read about the old Kubler-Ross stuff, denial. That hasn't panned out that well in the literature. It's not that some athletes don't deny, but the 5 steps of death and dying that they took and they kind of put in, it usually doesn't hold up well. Probably at best you have 3 stages. Stage 1, this gal gets hurt. She's trying to do injury-relevant information processing. What did I do? Is it serious? What should I do to treat it? Going through there. And again, if you've been hurt a lot, you might end up doing better on that because you've been there. Or you might be totally freaked out because here we go again. So again, a lot of individual variation. And that leads to emotional upheaval, reactive behaviors. The football, unfortunately I see the game and somebody gets taken off the field. There's always Sally carrying him out. The huge guy, and then there's little, Sally in there going off. Well, okay, then the guy gets on the sideline, and then he kind of realizes what's happened. Then he might get really pissed off because I can't play now. So you've got to work through that sort of process. And then obviously, we're hoping to get to a positive outlook in coping. Now, the crazy part of that, people run this course at different rates. Some will work through it pretty quick. Some sort of get stuck in different phases as they go through. Obviously, I'm going to breeze through this because I want to get to the rehab stuff. But identity loss is something that comes up quite a bit. And again, for the athlete, I'm a D1 basketball player, and my whole life is basketball. And then all of a sudden they get hurt. I think I can say this, that we had Jeremy Langford volunteered to come to talk to our summer coaches school we run each summer. And, he was obviously disappointed because he's had these injuries. But I was very impressed with him because his athlete is tied up in an identity. He seemed like he had strong faith, spiritual. He had some other things. So while it was really hard for him, and is really hard, I was glad to hear, again, I'm just hearing it once he was on a panel, but I was glad to hear it wasn't this or nothing. It's still got to be really hard. Okay, and this was before the latest round that he's gone through. But again, obviously we want to be looking for that athlete whose identity is so wrapped up, she can't get by it because you're going to have problems in the recovery process. Fear and anxiety, Indra Lip is a great example. Not so much fear, but just sort of the wear and tear. I mean, he got some criticism in the press when he retired, but he just said, I've been hurt for 2 years, and I'm beat up from rehab, and I'm tired. And he's a pretty smart guy, went to Stanford, probably financially secure. Like, why am I doing this? As you go forward. Lack of confidence, we'll come back to performance detriments. Again, I'm skipping some of this for time. This is one that I wanted to ask you, so I wanted to have you partner up again, or in a triad, or whatever, who's ever around you. Based on your experiences, how easy or difficult is it to spot poor adjustments to athletic injuries? So somebody gets hurt, first, I always find this is weird to talk about, because anytime I've been hurt, it's not normal. At least I don't want it to be normal. So we're talking about anybody who's hurt is abnormal. But when is it like really abnormal? This person is just sort of, I'm really worried. Can you spot those people fairly quickly? So that's my question. Or do you get fooled a lot? Like I thought everything was fine and all of a sudden it's a problem. And the second, based on your experiences, what are the warning signs of poor adjustment to injury? And again, I always couch this like, being hurt sucks. If you're hurt, it's no fun. So it's not like, oh, great, I'm hurt. So everybody's struggling with it. But when do you sort of have those warning signs go up? Actually, a friend of mine who wrote some of the work on this, he used an example. He was consulting at a clinic. A kid was hurt, and 2 weeks later he committed suicide. And he got interested in finding out more about warning signs because nobody realized how hard it was for this young person, this 15 or 16-year-old going forward. And there might be other issues in the background. All right, so I'll give you 5 or 6 minutes here. Answer those 2 questions with some of your buddies around you. Tracy, you'll have to find your friends. Okay, about a minute more.
Okay, so just so you know, the camera is right behind you.
Okay, if you could end your conversations, please. So relative to question one, what kind of things did you discuss? Easy, hard, have no idea? How about Fox right here?
We kind of discussed that athlete who's usually involved withdraw from their teammates and from the coaching staff. That's kind of that they're not adjusting very well.
So yeah, withdrawal would be part of it. Of course, that's where, hopefully you're in a situation, and like some high schools, you're not in a situation, you have 200 kids, but hopefully you know that introverts and extroverts. So somebody who looks withdrawn is just shy versus somebody who's not. But that's one that comes out quite often. What other things came up were discussed? Thank you.
It also may depend on how long you've worked with the team that you're with. If you've only been with them for like a semester, like a lot of the students, it's hard for us to maybe realize when someone's struggling.
Great point. If you haven't worked with them a lot, what would be the solution to that? I mean, you don't have a lot of, like here's your team, welcome. I go back to, again, if you're able to do it, and you're not always, but if you can get a meeting with the coach, sit down with the assistant coaches, look, sometimes I'm trying to get an idea. If somebody gets hurt, I might come to you to ask, if you notice anything. Are they withdrawing more, et cetera? So you try to educate the staff who might know them better before you do. Because what I liked about your example, in the real world, the textbook, you never write it, there's always a perfect scenario. In the real world, hey, somebody got hurt or sick and you got to take this team over. Hi everybody, I'm here to help you, but I have no idea who you are. And we've got to kind of move forward. The other thing is, in some of your for students, some of your communication psych classes, how do people in sales do this? How do you build rapport quickly? How do you get to know people quickly? Because that's sort of a skill you might need in a setting like that. And it's not always, I can tell you when I moved back here in 2004, I went through 3 general doctors before I found one that would listen to me. Most of them, it was like going through. And the one I have now, she's great. She, I can go and she listens, those kind of things. But others might have been pretty good doctors, but it was just like I was going to a machine, and they just sort of give me in, and I needed answers, and I had questions. Okay. What else was discussed in the groups? Easy, hard, what were some of the second question? What were some of the warning signs you looked at? How about up here in the cheap seats? No free pizza here, folks. Who's going to help me? What are some of the warning signs? Anything? Thank you, sir.
When their roommates or something come to you and let you know that maybe they are not hanging out with them outside of school or things like that.
Yeah, that's
drawn at home.
Yeah, that's a superb, a better example than I gave to the young lady's question down here. Sometimes teammates, college situations, roommates. It's funny when we do leadership sometimes, it's not just about the team captains. It's about everybody on the team needs to be a leader. And if the players are in the off season or something in their bar and somebody starts making a bad decision, another athlete steps up, we just don't need to go there. They don't give them a lecture, they're not their father or mother, but they get them out of that situation. And you could tie this in, hey, we're all here to help each other. And it's not a bad thing to help somebody else by reporting unusual behavior or whatever, and we have a system for that. Good. Any others? Come up.
Talked about the athlete that kind of just says I'm okay to everything, and there's no like within a 2-week span there's no progress of it's better, it's worse, they're kind of just bland and you can't really crack the shell for them.
Yeah. Yeah, that's a great one. That everything's fine and nothing's happening. Everything's fine. Everything's fine. We had a lot of the ones that they talk about, and I'll make these slides available. But some of the ones that have been reported in the various readings and literature, feelings of anger and confusion that last a long time. So, an athlete gets hurt. Some of the skiers I worked with, slalom skiers, she blows her knee out, she knows it, she's throwing her gloves, and if they're, okay, you got it done. Now they're sort of going through and they're putting the pieces together and going forward, versus somebody that's angry a month later. And that's where roommates and other people can kind of be helpful, or family. Obsession with the question of when to return to play. And again, with really hard driving athletes, you got to know them. But hey, this just seems abnormal for an abnormal situation. Third, denial, repeatedly coming back too soon and experiencing re-injury. Exaggerated bragging, sometimes the opposite. It's a little bit like sometimes in sports psych we talk about some confident athletes go around bragging all the time. They're so insecure they got to tell you how good they are. So sometimes you get that with injury too. Dwelling on minor or physical complaints, guilt about letting the team down, a big one with withdrawal from others, rapid mood swings, statements indicating that no matter what's done, recovery will not occur. Now, the trouble with these lists, first, they're good to know. But we probably know people that aren't hurt that have some of these. Yeah, he has mood swings all the time. That's why he's a pain in the butt to be on. Nobody wants a room with him. But so it's sort of like what's, it's like when you see a couple of these, or the magnitude of it is just not normal. It's like bigger than it normally is. Bruce.
The last one, statements indicate no matter what is done, recovery will not occur. Those patients were always my favorite patient when they walked in and they admitted that. We're not faithing in here. I'm pretty sure we can fix that. Just do what I tell you. They don't have to believe it. It was interesting. Those patients usually did really, really well, but they go, I'm only here because my wife made me, my doctor made me, my whoever made me. Fine by me. Do what I tell you, you're going to be fine.
Yeah. And I'm really glad earlier tonight you brought that example up, because sometimes I think we fall into the trap because we're working with a D1 athlete pool here. That if you're out in a high school situation, I was kind of playing football because my dad wanted me to. So I'm not really working that hard, or like workman's comp situations. I didn't like my job to begin with. Now, the longer I'm hurt, the less I have to work, type thing. So you got to realize that it's going to change a little bit with that. Okay, let me push on, just being aware of the time. Obviously, if you get a really abnormal reaction like here, you'd probably report it to Sally. Perfect timing. She walked in. She must have knew I was going to give her. But you report it, and then it would be referred on, and Dr. Rosen or other people would be there to assist in those kind of cases. It's not something that we'd probably be dealing with at our level. Let's talk about rehab to finish off, and then I want to talk about some of the practical things I brought. Obviously, we want a holistic approach. The more and more research is showing that recovery, actually I put one of the first studies ever done. They looked at people with ankle sprains, and ones who healed fast and ones who didn't, and they went back and interviewed. And the ones that healed fast did goal setting, they did mental skills stuff. They were doing like a lot more besides just the physical protocol. And there's more studies to do that, like a recent randomized control trial showed that psych skills training can aid in recovery. That was a study I talked about earlier. This broadbent down in New Zealand, they've done a whole series of studies on that. So obviously your injury treatment, you want to, kind of build upon that with a psychological component to it. Hey, if I go see you, I want the physical stuff first. Tell me what exercises I should be doing, but with that, having done some physical therapy myself the last few years, the rapport the physical therapist has with you, do they listen to you? And I've had some chronic stuff, so it's harder. Like, hey, you went through, and I ended up with gout, which I never even knew what it was. But I kept, we ended up with some things, and it was inflammatory, and some of those are harder to do. So that whole aspect. Really important one, athletes will not automatically transfer psychological skills used in sport to their injury rehab. In fact, one of the things I study is what we call life skills. What you might learn as an athlete, do you then use that when you have a group project in class about communication, whatever. So we don't think this transfer is normal. So actually the first page of the handout I did for you, this isn't anything validated, but it was a psychological skills background and transfer assessment. So you might have an athlete and you might have them rate your knowledge of sports psych or mental training. And it's okay if they put very little or if it's been great. Have you ever worked with a sports psych consultant or a mental coach? You'll get, hey, I did a little bit in a camp with tennis. Or we had somebody come into swimming sometime. Or, oh no, we have somebody who works with our field hockey team all the time. Right? What's your biggest psychological strength as an athlete? Okay, so you could just ask an athlete this. What's your biggest challenges you faced as an athlete? And tell me how you overcame them. That's going to give you a little information. And maybe when I came into it, Sally was like stretching somebody out or doing something. So you guys are always having conversations. You could pick up some of this information, especially if it's a person I don't know well. How often do you use each of the following? And I took what I think are probably the basic psych skills that you're going to want as besides communication and rapport, those kind of things, communication skills. But goal setting, previous use. How often do you set goals? You get a lot of people, well, I set them all the time. Well, tell me what you set last week versus the one that comes in and, remember, again, I know he's a kin major a number of years ago, but Kirk Cousins asked for an office when he went to Minnesota, and the guy's sort of a writer-down guy. It's probably a different approach to goal setting than some of the players you know. Okay, how are they with self-talk strategies? What kind of things do you tell yourself when you don't want to go in the weight room? Or, again, use the resources. I'd go talk to Red. He knows the Olympic sport athletes. What do you use to get them motivated? Pre-performance mental routines, do they do it? Do they do relaxation training, or you hear a lot about mindfulness training now? The Army's doing that a lot. Do they do any visualization imagery? And what I had here is, do they do it, and do they find it helpful? I once interviewed we had a great speed skater many years ago, Bonnie Blair. Like, she's won about 16 gold medals. It's unbelievable. But I asked her if she did sports psychology. She said no. Because somebody, when she was a junior athlete, said do imagery, and she didn't like it. Then I interviewed her for an hour and a half, and she did everything in sports psych, goal setting, imagery, not imagery, but all the other things. So that might be a way to find out where the athlete's coming from. Okay. The other area, I don't want to spend too much time on this, with the whole rehab area, there's probably two elements in the literature. One is adherence to the rehab protocol. If I go to the training room and you leave your athletes alone, how good are they doing it? Do they, in D1 athletes, you can control them better, like a better word. Private practice, high school kid, how many sessions will their insurance cover? Then are they on their own? I'll use myself as an example. When I did physical therapy for my knee, I still do the exercises every day. I'm pretty good at that. I'm very proud of myself. Now, that's the good news. The bad news is I think the quality is not what it should be. They give you those one-page sheets with the crappy picture on it. Then they show me 8 exercises in one day. And a year later, okay, when I stand on one leg, how long am I supposed to hold it for? Or am I doing the full range of motion, or am I holding it long enough? Again, it's hard to do. Why don't we put them on the phone? This generation likes everything customized if you buy something. So when you show me, now, if you have an intern in your office, video this. I take Dan through the protocol. It's on his phone. Here's your 8 exercises, Dan. I haven't been to physical therapy for 2 years. I'm still doing some of the exercises, but I know I don't do some of them, like some of the pointers I forgot, or you're tired, and you're sort of going through the motion. So if I had the phone, I could take it out, and I could even have the cues that he gave me as you went forward. So that, I think, is an option. Now again, depending on how your practice is set up or what you're doing, you could do an option where you just do all the exercises on the phone and it's sort of generic, there you go. Or I could customize it. When you're doing it with me, we video it, and I have these little clips on my phone. I actually think that's an area we could really do. It just always amazes me, like, why aren't we doing that more? Because again, I'm good, I'm trying to do my exercises, but I know I'm not doing them exactly like he told me, because I forgot some of it, and sometimes I'm lazy. I know true confessions. Okay. I'm going to skip here, just do a few things because of time. Some guidelines if you want to know. I already mentioned, like, you want to, where is the athlete on their psychological skill use? Try to do a stress audit with your athletes when they come in. So week to week to week, where are we? That's where I think the one question would come in. How's school? Again, if you get to know them more, how are things going? What's going on? I did a talk for football here this summer, and I know Coach D'Antonio has like a yearly meeting with each player, and it was really interesting when I looked at what he assesses in it. Like, tell me about your family, who are you close to? And a lot of it had nothing to do with football information. It had to do like the young person's life and where they're coming from and the other kind of things. As an athletic trainer, we might want to know some of that. So how's your brother doing? Oh, I heard your brother went to Indiana. So we can pick up if they're going to be at risk for certain kind of things. As I just talked about, focusing on the quality of the rehab. Kind of a fancy way of saying it, quality of execution drift. We know when we do any kind of intervention study, people do it really well the first week, the third week it's not as well, the 5th week it's not as well. When you're having athletes rehab. Now again, football or basketball here, they got a lot of people helping them. What's rehab look like, and I don't mean this in a bad way, but with the swim team or with the wrestling team when they don't have as much support? There might be one trainer, they're doing some on their own, and how do we monitor that better? Sounds funny, but have your athletes mentally prepare for rehab. Okay, so I show up for my rehab session. Did I screw my head on to come to it? A friend of mine, actually, is a former friend, sadly, Ken Revizzi. He worked a lot with professional baseball. He was with the Cubs. He died about 1.5 years ago, as a lot of the papers. But he used to come in and he used to get all the athletes, before he'd do a session, stop, close your eyes, take a deep breath. He'd do some centered breathing. He'd take 40 seconds to get focused. Now, I'm a little crazy when I teach, but I've tried that with my classes once in a while. Okay, let's take a minute to psych up for class. 8:30 in the morning, it's a stretch. But sometimes I think if Tom Izzo was teaching my class at 8:30 in the morning, what would it be like? Or Susie Merchant. And so in a way, when they come to your performance domain in rehab, do we do anything to get them to click in? There's some old work by Terry Orlick where he taught athletes just little ritual type things. So if this was a training room, you hit the door on the way in, so I come here, and I park my problems, because when I'm in the training room or the weight room, I'm here to focus. And on my way out, I can pick them back up again. So if I had a fight or I had a bad test or something, park it, come in to do the quality of rehab, and to leave. So again, those are little things you might do, and you have to fit it in with your personality and other type of things. But sometimes, hey, just wait a minute, hey, look at my eye, take a deep breath. Let's get focused. I know you had a lot going on today. It's exam week. Thanksgiving's coming up. You with me? Okay, let's go. Just things like that. And I think a good place to learn some of that is when I've watched the strength coaches in the weight room with them. If you could remodel some of those techniques for how we do sort of rehab, even though we're not trying to get maximum effort. Key psychological skills that you want in your arsenal. The more you can learn about stress management, the better. Goal setting, self-taught, imagery, and one I haven't talked much about, but there's a lot of research on social support, which you're part of the social support provision. And there's informational support, emotional support, like who's going to be the right person from them to talk with. If somebody's sort of a high-maintenance recoverer, and you've got sort of an athlete that you're worried about, don't put them on the training table next to the one that belly aches the whole time. If you can do it, let's just separate that out as you go forward. A really good one, I know when I worked with the ski team, and skiing in some ways is like football. They play once a week, then they travel, then they go to the next week, they travel. And sometimes the athletes, when I talk with them, if they get hurt and their season's over, they're not traveling with the team, and they feel isolated. And sometimes it's like when you're sick, you're not caring about starving children somewhere, you only care about you. And you go, the coach doesn't like me, the coach doesn't call me, and so what you might want to do as a trainer once in a while is say, hey coach, why don't you give him a text? Or why don't you give her a text just to sort of check in? So they get maybe that support from the coach, because I always tell the athlete, like, you got hurt, so now the coach has to fill in with somebody not as good as with you. So they probably don't have a lot of time to be thinking about you, even though you'd like them to. I'm gonna, for the students in here, again, I know you do various kind of projects, but if you're interested in this area, I know Shelby's interested in it, some other people, you might think of some of these areas. Expand beyond injury to illness and the role of sleep may play. I think one area that I wish there were more studies on athletes getting sick because they're tired, not sleeping enough, then all of a sudden the whole team has the flu or whatever it might be. How does that interact with like recovery? Overuse injuries is, to me, the black box. We're starting to see some studies. I mean, one reason you don't see studies is it's harder to heck to know what's going on from it. Determine how to help athletes distinguish between normal training pain and injury training. That would be pretty exploratory, but important. That I was alluding to use of technology in facilitating injury rehabilitation, quality, and adherence. Anything from like the cell phone usage or iPads or whatever. One I haven't talked about is return to full athletic functioning after injury clearance. I get cleared from the doctor, but am I really ready to play? And a lot of the athletes I've worked with, there's a whole confidence factor. I always say, like, they need to go out and fall down on the knee or the shoulder they hurt and get up and realize it's okay. But until you can't orchestrate that, but until that happens, again, talk to each other about it. I know one coach, one physio I talked with the ski team said that what they figured out is the athlete would come back from a season-ending injury, they really shoot, for the next one, or actually season-ending is not the best, but they were out 2 months and they're coming back. he said a lot of times there was such a buildup to come back for that first World Cup event, the Saturday. And then the next one, they slip down and might even get re-injured. So what he said, we'd bring them back for one, and we wouldn't play them the next week, but they'd go 2 weeks. So in other words, they kind of brought them back slowly. So, okay, you're cleared to play, and you played the 1 week, but now it may not be the same the next week. So they had almost like a periodization plan for getting you back on the field. And again, what I mentioned before about the modeling, hooking athletes in pairs, where one that had the same injury might, again, you got to have the right personality, but counsel the other about what it's like to come through that whole experience. Let me stop there, and we'll look at the handout quickly here. The second page of it, I just put a quick goal setting injury sheet. Tracy was asking about some practical things. So that's on page 2. My rehabilitation goal is, sometimes we talk about outcome goals. I want to earn my starting spot back on the team. I can't control it, but it's a lot like winning. So I want to place in the Big Ten tournament. Not a bad goal, but okay, that's fine. Performance goals are to place in the Big Ten tournament, I need to do X, Y, and Z. I need to swim a certain time. And process goals are I need to work on my terms if I'm a swimmer. Now, if we put that in rehab, my outcome is to probably return to play, getting my starting spot back. The performance is like, what are the metrics we're using? Range of motion, endurance, extension, all the stuff you know a lot more than me. And the process. How many times a week am I going to come to do that? Do I need to do anything at home? Do I need to limit what I do? Goal setting is one of the simplest psychological skills that gets messed up. It's almost like too simple. How many in here are setting New Year's resolution? How many wrote it down? All the research says, oh, hey, one person good. Ink it, don't think it. But why? Because it was a good idea. So the whole idea, did they write the goal down? I will achieve my goal by doing these rehab exercises with this quality, those type of things. And then I always put a little checklist at the bottom. Is it specific? Is it realistic? Do they really buy into it, or are they just pleasing you because I like you, you're my trainer? Sally, I'll do whatever you say, But do I really kind of commit to it? So that might be a form you could adapt and use. The third page I put in here, somewhere, pretty simple, but another one, again, comes from some of the strength training. What words, phrases, or images do you find are motivating to you? Kind of age dependent, but the old Rocky movies, running up the stairs, certain kind of music, fire, women's soccer, in one of the Olympics we studied them, they had fire and ice. Players would yell fire, it means get your butt in gear, and ice means cool off and don't get a yellow card. And they yelled to each other. Colleen Hacker worked with them on the field. All right, do you have cue words for yourself? And what ones kind of put you in the mental toilet? You know, like me, I have pity parties. Oh, poor Dan, I'm getting old, my shoulder hurts, this, blah, blah, blah. Okay, on the days I'm having a pity party, sometimes, I'll give you an image that works for me. I did some work in Ethiopia a number of years ago, and I saw this, lady must have been 70 years old, carrying all these bamboo on her back every day, walking up this mountain hill, and then back down. And you could tell she was really impoverished and poor. So when I'm starting to have a pity party, it's like, well, I think of this lady. And I go, maybe I don't have it quite so bad. My cable TV didn't work the way I wanted, whatever it might be. So, but you have to play those little mental games. And one thing with athletes, have them memorize some key words. Have them write it down, put them places. If you know them, you can use those words when they're, we all have tough days with rehab.
You didn't sleep much last night because you had tests or other kind of things. Again, your strength coaches are good ones there. A belief wall can work really well. I did this with a number of years ago with an MSU women's basketball player. It's the last page of your handout. So now you've got an athlete coming back. She's coming back from an injury. All it is like yours is blank, but it's like a wall with bricks on it. And you take those little yellow 3M, stickum things. Tell me all the reasons you should go back and be successful after an injury or after rehab. This one wasn't for injury, but I'll just read it because it was an actual case. I train 6 days a week in summer ball. I have trusted teammates who support me. I have assistant coaches who care. I have great relationships. I proved I belong. I will graduate no matter what. I have the X factor. I wanted more. I'm learning how to let go and take the pressure off. I'm in great shape. I'm driven. I know I can play at this level. My family and friends support me no matter what. I figured out a lot of my first 2 years. I love MSU without basketball. I train 6 days a week in the summer shooting. I've worked to improve my mental game. So all I asked her is tell me all the reasons why this was coming back from something. A number of years ago I did this, but she just came up with her belief wall. Why should you be a successful athletic trainer? Well, I went to MSU and it's a pretty darn good program. I interned in some crazy situations, but I learned a lot. Okay, whatever it might be. But I was thinking you could do it for somebody coming back from injury. So you're just about ready to clear them. Hey, let's do a belief wall. Now, this person, I actually typed it up and sent it to them. Put it in your locker. When you're having a bad day, and what I really like about this belief wall, we did it with corporate people. Why should you be successful at Oracle? Because we're doing this, and this. But there are things you came up with. I didn't tell her what to put here. I have to tell me all the things. And all of a sudden, this scale ended up with 15 reasons she should be successful. Pretty darn good confidence builder. And they came up with it. Okay? Let's see what else I've got here.
Do you know the rest of the story of the belief wall? How'd you do afterwards?
In this case, I don't know. I can give you some cases. Actually, one of the best consults I ever did was a figure skater who had major hip surgery. And he was going to pack it in, and he just was unsettled. So he decided to go in. He stayed the next year, worked great, went back and finished last at Nationals. Best thing that ever happened. He left the sport on his own terms. He was going to quit when he got injured, and he had a lot of baggage, and so his goal was to go back. And he actually skated pretty well, given he had the hip surgery and some other stuff. But I always tell people, I've had people win that go to the Olympics. And he's probably the best work I've ever done with somebody, but he did a belief wall. And his goal, and I'm so proud of him to this day, because he ended his sport career, 14 years, whatever it was, skating, on his term in a positive view, even though his injury prevented him from kind of achieving what he had hoped to from the front end. So I know they can work pretty well. The basketball case I did, I saw that person once or twice. Okay, the other one I have is on page 5, a little relaxation exercise called centering. Again, you can go on the internet and find relaxation things pretty quickly. But centering is, I jump up when I land, I got a good stance, take a deep breath, inhale through the nose, stomach expands, exhale through the mouth, think easy, my shoulders drop. Hey, we're in a training session. Come here, look at me. Inhale, take a breath. Really good way if people practice it. You see athletes do it all the time. But again, you can use it in different scenarios. To calm an injured person, in the rehab kind of setting. And what's great about all these, they can be used in performance enhancement setting as well as the injury setting. Over on 6, I put together some stuff for you using imagery in athletic injury rehab. You might be able to use imagery in 3 different ways. Way 1 is imagery as a sports skill mental practice. So I'm a football player or a basketball player here, I'm hurt.
Well, I'm doing my rehab, and provided it doesn't interfere with the quality of the exercise I'm doing. On the TV, I'm watching game film of myself as a point guard, running the offense. Or I'm doing imagery, or I'm like when I did some PT, they put the electrical stim on or ice me for the last 15 minutes. You just lie there. Well, you could have your phone looking at game film, imagining you were in it, that type of thing. The second is kind of confidence or emotive imagery. So you start thinking of yourself coming back, what it's going to be like. Maybe you think of yourself scared and sort of overcome it. And the last one, I put an actual example here from a research study, healing imagery rehabilitation script. So this would be, you can read it on your own, but it takes you through how you do an actual script with somebody that they record it, put it on their phone, and then they would listen to that. Typically in these studies, they sat with one session, talked about it, they made the recording, then the person took it home, and they used the recording 3 days a week or whatever it was as they went through. Again, the realist in me says half the people won't do it, but I'll take the 50% who will. Okay, let me stop there and ask for questions. I've gone pretty hard here for probably longer than your butts can take it, but see if we have any questions at this point. Yes, sir.
When you say stress management skills, like what specific stress management strategies are helpful for people that are able?
Okay, one I just remembered I probably skipped in the handout was thought stopping. Thought stopping is a strategy where I come in and like I'm just mad at the world because I'm hurt. I don't like to lift anyways, and I just have a negative attitude. So what do I see when I come to the training room? This sucks. I can't believe I can't play. You have them write down specific quotes. Like it can't just be I feel bad. This sucks. I stink. Whatever it might be. Then, so they have to write that down. Then the second step is they think of something that would signal stop. Could be a stop sign. I've had guys, I don't know why guys say it, but their moms yelling stop. Could be a finish line. I once had a NASCAR driver think of an elephant, because once he won the Daytona 500 and they put him on an elephant. And actually he was driving his car and he had an elephant on the row bar. And the announcers are going, he must be a Republican. I think, no, he stops it. But he stops. And the real key is at the bottom, they have to have specific replacement thoughts. So I suck, or I'm not going to ever get better. Stop. It may take a while, but 1% better each week. So some realistic statement. So that's one. I actually have the form in your packet, where you identify the situation, the specific negative thoughts, a stop signal, and then specific replacement thoughts. So that would be one stress management strategy. The centered breathing, sometimes just get people to focus for a second. You can Google the mindfulness stuff now is sort of just not being judgmental. There's training programs they can use for that.
Are there some strategies that help with specific injury types, so imagery for ACL injury or something like that?
Not that I know of, but I actually looked at quite a few of the intervention studies, and the script I put in the handout actually has you, that's where you're, like Chris, if it was ACL, they talked about having the cells come in, the good cells take over the bad cells, but you might actually talk about if you showed them what the ligament was. So, like in your medical books, they always have, no skin. They show the muscle groups and the ligaments. You might show the athlete that. Then the athlete might do, when they do their imagery, they might view, like, again, you got to put in their terms, what the good cells coming in or warmth coming in and overcoming, whatever it might be. So there's some creative part to it. One of the things that's frustrating is most of the studies never put the scripts in. I had to look around to find like a real script that I could give you on that. Other questions? Yes, sir.
Is there anything that indicates giving a timetable to return to sport or return to activity is beneficial or not beneficial for vision?
I've never seen anything on it. You almost could argue both ways from a goal setting way. It's if somebody's a really good goal setter, specific dates, they have something to shoot for. If somebody sort of doesn't like that, and actually go back many years, but our wrestling coach, we used to have a debate about whether they put the practice schedule up, about what you're going to do exactly in practice, because would some guys pace themselves or not? So I think you probably want to customize it. From the goal setting, having target dates is pretty important. The problem with injury stuff, it's not an exact science, and you get fast and slow healers, as you know. That would be the sort of downside with it. So not a very good answer, sorry. Other questions? So do I turn back to Tracy? Oh, so yes, ma'am.
Okay, so when you're talking about like using an explicit technique to transfer the psychological skills, since a lot of your work is based off of explicitly transferring life skills, when it comes to people like you, what is the best way to get to make sure that it's being reinforced with everyone and not just you explicitly training like or providing them those skills? How do we get everyone on our team to also reinforce?
Yeah, great point. Anytime we talk about like skills athletes learn in sport, if they're going to transfer, who's ever in the transfer situation, it helps if they ask. So if they kind of reinforce, but the other would be like coaches. So if I'm a coach and I'm covering things with an athlete, okay, we were really successful this week by playing as a unit. Would that help you for a group project in class? Just sort of asking the question, and the more people that ask it, so I like the way you're thinking, the more you have a system, and the more the system, athletic training here works because you have a system. And Sally implements certain things and people follow the procedures. And the more with any of this mental skills training, you always have to customize it, but the more, so you're trying to do recovery from injury, and the head coach doesn't pay any attention, but the head coach sends a text once in a while, or maybe you remind her to send a text. It makes a real big difference for the athlete. The coach probably appreciates it because she's so busy trying to replace the person, but it's a system. And so I think that's a great way to think about it. Yes, ma'am.
In a time where I feel like we're seeing more people with less coping skills,
Yeah.
how do we help with that? Or how do we continue to develop that if it's not either already there or?
Yeah, that's a great question. Actually, some research we have now we're doing with, hopefully we're going to start a study. Michael, is he still here? Or he was here, but with Gen Z athletes. Gen Z are people, hi Michael, born after 1996, and they have some amazing like technology skills, etc. But there's some evidence to show that parents have overprotected them, not let them fail as much, and that's, some people think it's the reason we're seeing, like when Brian Hainline was here, the mental health, suicide, anxiety's up 8-9%. And it's on one hand, we're trying to meet them where they are, and especially on our campus, we're so, and I want this to come out right, because of NASA and all the stuff that hit, we're so concerned with protecting young people, and we need to be. But the other time, they need to fail sometimes, and they need to deal with some adversity. With coaches, I think it's sort of being made pretty explicit with it. Like this one wrestling coach we studied who was pretty effective. He ran these summer camps. I'm going to hold you accountable, and where your parents wouldn't, because I love you. He would just say that, and he'd hold them accountable, but he'd always give them a lot of choice. But there were like contingencies, and he'd put them in increasingly more stressful situations when he taught them some skills. So that's sort of, the one is sort of, we got to teach them some skills, coping skills. So some of the stuff, just some of those little exercises I gave you. And then as we progress through a season, we put them in more stressful situations that and good coaches do this, that they can handle. It's going to be a huge challenge for us. I was actually, I'm going on, but I was in the Senate yesterday, and they were talking about like there was this controversy about this social science study, and they took like internet posts that were racially, terrible, and people, it just caused a big stir. And on one hand, obviously we don't want to do anything that's offensive to anybody. On the other hand, there's part of you, there was a book I read, The Coddling of the American Mind, that we're trying to protect young people so much, are we really doing them a disservice long run if they don't learn how to deal with problems and other type of things? And I hope that comes out right. I don't mean it in a mean way. But, a youth development researcher said the most important question for a parent is, when do you intervene and when do you let your child fail? And I say that for coaches. When do you intervene or when do I let them fail? Because failure can be a great learning experience if they have it. And we've got to figure that out. I don't have a great answer. We'll be interviewing some coaches and athletes trying to find out more about that, Michael and I, as we go forward. Other questions? Yes, ma'am.
Do you think there's a role of religion in recovery at all? Because I know a lot of people who are like really strong in their faith, it just, I don't know, kind of seems like they might recover faster, so.
Yeah, that's a great question. What role does religion play? It's interesting that I've worked with athletes, Fellowship of Christian Athletes. I've worked with atheists. I worked actually one time with a gal that believed a lot in angels. It wasn't research, but like angels. And I've always been careful not to, put my own bias on it. But I think somebody who's connected spiritually with something bigger than they are has more, a lot of the centurion research shows that people who live to 100 tend to have purposes in their life. You have meaning. And there's some sports psych researchers, Ken Revisit did some, athletes who know why they play. The first women's soccer team that won the gold medal for the U.S., Mia Hamm, Julie Foudy, all them, they played for every little girl in America. They felt they were playing for every girl in America. Krzyzewski does that with the men's basketball now. He takes them to the Statue of Liberty to have a bigger meaning. So I think it's spiritually, if you're like Fellowship of Christian Athletes or whatever it might be, it probably gives you, a meaning to your life that maybe allows you to go through certain periods being more at home with yourself. Like I know, God loves me no matter what. And if this fails, I still have that belief. And regardless of whatever Allah, whatever religion it is. So I think it could have a really positive effect for that athlete. Okay? But I also think for some athletes that are atheists, if they find meaning in some other way. So to me, the construct there, it's hard because we're talking about religion, but the construct for me is a meaning and a sense of purpose. Athletes who are going through an injury and have a meaning or sense of purpose of why they're doing it, I think are going to be less likely to have the poor me quite as much. Yes, ma'am.
Do you think that, just in your opinion, with the push towards paying our D1 athletes for their image and likeness, and that we might see a larger issue with adjustment to injuries in this population due to that excess pressure?
I don't necessarily see a link there. I think the whole system is going to be a lot more complicated. And I just know from the studies we did with the Olympics, you're a coach, you're trying to get your team focused. 2 weeks before the games, your agent is trying to get you shoe contracts and to go out 2 weeks before the game. And in the little sports, swimming where you don't make money all 4 years, you almost need to kind of do that, but it can interfere with coaches trying to have high performance. I was talking about this, Bonnie Blair. I remember she told me, because she was the darling of all those Olympics she was in, the photographers always wanted to do one more lap on the oval in speed skating. And she finally said, look, I'm doing like an extra practice taking pictures for Sports Illustrated. And we're doing 2 laps and that's it. Get your pictures, boys. And we're over. So I think it's going to complicate the situation, and we may have to kind of navigate through it in different ways. But I don't necessarily see a direct effect on injury, but maybe I'm not smart enough either. Well, I know I'm not smart enough, but maybe I can't make a thing. Sally, don't agree so quickly. Others? I guess I'll turn it back to Tracy.
So I'd just like to thank Dr. Dan Gould for that wonderful lecture. And it's always hard to get somebody who's a diehard Spartan fan something. So when I was looking in his office the other day, or a month ago, seeing what he had and what he didn't have, and I've been to his house quite a few times to see what he has and doesn't have, I'm hoping I got you something that you don't have. And we are very happy that we got you a signed football from the winningest football coach in FSU history by Coach D'Antonio. So thank you very much for a great lecture. If you guys could please complete the evaluation forms that you have picked up. That's a requirement for our lectures, actually for our VOC, so if you could please complete those.